The other thing that often happens is doctors tend to be pretty numbers focused. And some of this is appropriate. Part of our job is to make sure that we are keeping track of the numbers and keeping track of what is going on with a patient, their vital signs, their lab results. These things are things that affect the patient's health, and it is our job to be aware of them and manage them as best we can. But that also can mean that we're focusing on a number that to a patient is not all that relevant. And there may be a lot of other factors in that patient's life that make them feel like getting this number optimized is not the most important thing to me. And I really want to take into account the big picture of what's going on in my life and make a decision about what's the most important thing to prioritize right now. This is further amplified by the fact that doctors, especially nowadays, are getting graded by insurance companies on the numbers. So they are getting graded on how many of your patients have their blood pressure controlled, how many of your patients have their diabetes controlled, evidenced by their A1C being below a certain threshold. There's a lot of these numbers that doctors are being held accountable for, and it makes it a little bit difficult for them to then help with a patient prioritize, like, what is most important to you. Maybe it's not this number right now. And so it's challenging, but I think it is really important to take that into account when we're looking at a patient, because the big picture is so much more important than the individual numbers. And so, I think one of the ways that we can kind of combat this sort of structural and systemic barrier that's been put in place between doctors and patients is by just sort of slowing down and introducing that humanity wherever we can. And it starts with just asking permission. So if we are, for example, going to be checking someone's vital signs, asking first, hey, you know what? I need some information to help me make a treatment plan. I would like to have you step on this scale and check your blood pressure. Is that okay? Are you comfortable doing that today? Just asking the question opens up that autonomy and choice for the patient that more often than not, they're probably going to say yes, but they now feel like, hey, I actually had a choice in this. It was not forced on me. And it gives them back a little bit of that control, breaks down a little bit of that hierarchy and barrier, and can make a huge difference. And it really doesn't take that much more time. And in fact, over the long term, it really saves a lot of time, because if you're able to get the patient to feel comfortable, they're going to feel more comfortable openly communicating with you about other things, and you're going to get more accurate information. You're going to get the full story. You'll be better able to understand what's actually going on, come to a diagnosis faster, and make a plan together with the patient that they're actually willing and able to carry out and follow through on, which ultimately is going to improve their outcomes. So it's a couple seconds extra time up front that can have huge implications later for improving outcomes and saving time as well.